Hello everyone, ladies and gentlemen. Before I begin my presentation, let me introduce myself. My name is Asrizal. I'm PhD student in Songkla University, second year and third semester. I'd like to give a presentation about a systematic review, the effectiveness of physical activities and exercise as a modalities of nursing to preventing diabetic foot ulcer. First of all, I'm going to start my presentation. Well, I will begin by sharing the first slide. My presentation is divided into 5 main sections: background, aims, methods, results, conclusion. Diabetes is a major health issue that has reached alarm levels. Today, nearly 500 million people are living with diabetes worldwide. The data in the world, 20,045, 700 million, 20,030, 578 million, 2019, 463 million, increased 51% in the world. The data in International Diabetic Federation 2035, 14.1 million to 2019, 10.7 million. And in Indonesia, national prevalence of diabetes mellitus age more than 15 years, 10.9%. For the treatment of type 2 diabetes mellitus, the current world standard prescribes first, physical activity like aerobic, walking, bicycling, and exercise, or foot exercise focus like ankle rotation of the foot. One of the most common complications of diabetes in diabetic foot, although there is a risk of infection, ulceration, and amputation. The goal of this review of systematic is to look into the efficacy of physical activity like walking, bicycling, and exercise, foot exercise focus, intervention for avoiding diabetic foot ulcers patients with diabetes who are at risk. Like this walking, and like this bicycling, and like this foot exercise, rotation of the foot or lower extremity, right and left extremity. Method. To collect the data, I'm using a systematic search strategy, electronic database such as PubMed, Embase, Cochrane, Medline, Web of Science, and Signals to investigating the efficacy of physical activity and foot exercise in reducing preventing diabetic foot ulcer and improving health of type 2 diabetes complications. This is my Prisma flow diagram. Through database search, records were discovered a total 300.2 articles from PubMed 71 article, Embase 42 article, Cochrane 43 article, Web of Science 27 article, Signal 52 article, Medline 67 article. Record after the flip card removed total 251 article. Then primary screening on titles and abstract assesses for eligibility using inclusion criteria, a total 97. Then record aren't included, a total 154 article. Final screening of full text and methodological appraisal, a total 39 article. Records excluded, a total 31. Not physical act, 10 article. Pregnancy, diabetes, 5 article. Qualitative, 5 article. Home care, 5. Not sick, 6 article. Diabetic for ulcer, 5 article. Studies included in quantitative will be synthesized, a total 8 article. The result, after assessing the data and applying the inclusion criteria, conducting critical evaluation through Joanna Bray Institute, data extraction and data synthesis, only a paper out of a total of 300.2 article match the requirement. When supervised, physical activity and group exercise were compared the unsupervised, the ankle brachial value demonstrated a considerable increase in blood flow, ankle brachial index 1.0 millimeter Hg. This is a normal range. This emphasizes the relevance of physical activity and food exercise in people with type 2 diabetes. I would like to conclude my presentation. Conclusion: physical activity and exercise are non-pharmacological therapies as modalities endorsing in improving the prevention of diabetes foot ulcer. This is my references. I'm going to end this presentation. Thank you for your kind attention and for your listening.